How you doing? My name is Tom Willman, physical therapist from Apex Orthopedic Rehab in Providence, New Jersey. Today we're going to talk about proximal hamstring tendinopathy. At the end of this video, we're going to give you 3 exercises that you can do at home without any kind of special equipment at the very end. But first, talk about what is this condition. This particular condition can be found in long-distance runners, endurance runners, and the irony is it actually can be found in people that sit for long periods. It's kind of like the perfect scenario for a weekend warrior that's highly active as well. Someone that's sitting a lot during the week and really going at it during the weekends and through the week as far as running. Anyway, so it generally occurs after about 2 or 3 months. It's been around for a while. It's not something that's really a tendinitis, which has just occurred. It's something that's been beyond that time period. With this particular type of condition too, it can be also confused with, let's say, a lumbar disc herniation, a sacroiliac problem, piriformis syndrome. It can kind of mimic some other conditions. So sometimes it's not as easy to identify. Some things that are associated with lumbar problems or lower back problems that'll give you butt pain will be very similar to what we're describing. So it can be a little confusing to get the diagnosis correct and then really get the right treatment for that person. So what are some of the things that we have to watch out for to make sure that we can even try these exercises? I like to call them red flags. Okay, and a quick list is to try these exercises, you shouldn't have had a recent trauma like a fall or something really like nasty that started this process, because maybe you have a fracture or something more significant. If you have progressive weakness, like you're starting to get really weak, we're talking a point where it's not like you got weak and didn't work out recently, or a couple weeks you've been getting a little bit, you've missed your workout. We're talking weakness, like, you may even develop a thing called foot drop, where you can't control your foot, and it's accompanied like balance problems, but it's got to be quick and relatively recent. The other thing is you shouldn't have a change in bowel and bladder signs, meaning you can't expel your bowel, have a bowel movement, or you can't retain urine, you actually wet your pants. That kind of inability to hold back your urine. So those are some of the big red flags. Also fever, malaise, kind of like we're looking for like something systemic, like a tumor or cancer, something very significant. Excruciating, severe night pain. That's also something. Okay, good. We got the red flags out of the way. After that, what we would do here, if you were here, is we'd make sure none of this is coming from your lower back. We'd rule that out and see if anything was associated with back movements. Next part, who is at risk for this? Sometimes some people that have a lot of weakness in the core, even some past abdominal surgeries can be a risk factor. They can have generalized hip tightness in their hip girdle, hamstring tightness will predispose them to getting this type of injury. They can also have a very poor warming up period, like they really don't warm up for this particular type of injury. They just go right into a run, and that's when they start developing some of this pain. They can have some gluteal weakness in the hip girdle. That's another risk factor. And also biomechanically, like sometimes down the chain, we always think about our body, from everything's connected. Sometimes someone may have some other issue further down, an old knee injury, an ACL injury that you didn't get back all your function, plantar fasciitis, Achilles injury. Some of these things can make you more predisposed and be biomechanical factors that can possibly make you more predisposed to this occurring. And lastly, especially if you've had an old hamstring injury that you've recovered from, you may still have some weakness from that particular injury that's kind of made you more predisposed to getting this one. So those are some of the things we have to look at. One of the other things too is you'll see a sudden change in training loads. People all of a sudden ramp up their training loads, or they don't warm up properly, as far as their starts. So a little bit of the anatomy. We have our lower lumbar spine, which is right through here. We have our sacrum, which is triangular bone here. We have the gluteal region. It's kind of where our buttock is here. Right from here, here's our buttock, and right about here is where the hamstrings actually attach, in addition to portions on the femur. Hamstrings come down all the way to the back here and attach further down towards the knee. Our area of pain is typically right around this region. They call this the sit bone or ischiotuberosity. So that's basically where a lot of our problems are occurring. This can be a region of past, hamstring tears. Occasionally when you have a hamstring tear in your past history too, you may even have a little pull of the bone, like the hamstring tendon attaches here, it yanks a little portion of bone during one of those injuries. but that can make you more predisposed to having this particular problem. Okay, so this is the first of the 3 exercises that you can do at home. A couple rules. I wouldn't do this more than maybe 2 to maybe 3 sessions a week, okay? Maybe 2 or 3 sets, about 15 repetitions each. Afterwards, a little soreness is normal, 24 to 48 hours later, but make sure the soreness is resolved before you go and do the next series of exercises, the next set. But you want to have at least a day in between so you have a recovery day. Another thing too, besides the active exercise, I want to make sure that you don't sit for longer than 30 minutes at a time, because that direct pressure on those bones we just showed earlier on can irritate the area that's trying to heal. Okay, so the first one is the forward lean or forward reach. So you're going to stand on, if this is your injured side, let's say it's your right buttock, you're basically going to lean forward, soft knee, and you're going to come forward like that as you lean forward, pause, and then you're going to come back up. If you have to, you can do it next to like a countertop, and you can put your left hand down just for a little bit of balance, but really allow most of the motion to occur from right here. And then back up. Okay, so that's your forward lean or forward reach. Okay, so the next exercise is a pelvic bridge. The only actually thing you need is one of these balls, typically 45 to 55 centimeter ball. So you're essentially going to do a lift, curl, back, and down, all the way up, draw back, extend out, and down. Okay, so it's a hamstring curl off the ball. That's your second exercise. The last exercise, you're going to do a pelvic bridge. I would suggest you do these exercises on both sides, even the forward reach. So let's say that the injured side is the left side. The opposite side comes up. You can put your hands like so, lift up, little pause, and then back down. If you want to make it a little more challenging, you can cross your arms, all the way up, pause, and then back down. Listen, I hope this helps you out. If you have any questions or comments, place it right in there. I'll try and get right back to you. Also, if you have anyone that possibly has this problem, please share and subscribe down below here are our channel. We constantly are posting different exercises that hopefully will help you move a little bit better and feel a little bit better. Have a great day.